Hi, my name is Abby Simpson, and this is my Module 3 assignment for Intro to Health Practices. It's my Health in Movies presentation. And for this assignment, I watched 50/50, which was a film made in 2011. The star of the film is a 27-year-old named Adam. He was running and has some back pain. So he goes to the doctor and finds out that he has schwannoma neurofibrosarcoma, which is a cancerous tumor in the spine. The doctor tells him that it is a mutation of chromosome 17 that invaded his lumbar spine, causing body erosions. He tells him that he suggests chemotherapy to shrink the tumor before going into surgery. So Adam has a lot of support. His best friend Kyle is seen here helping him shave his head. He also has support from his mom, dad, and his new dog, Skeletor. Skeletor was a gift from his girlfriend. They actually broke up a couple weeks after she gave him the dog to help him go through treatment. She read that they are helpful for healing, and so that is why he has Skeletor. So he's pictured in chemotherapy, and it doesn't help shrink the tumor. It did not shrink it at all. Throughout this chemotherapy, he develops a relationship with his therapist, Catherine, and Mitch actually passes away, one of his chemotherapy friends. So the surgery was remove the tumor. They had to remove more of the bone than they wanted, but it was successful. At the end of the film, Catherine smiles and asks, "Now what?" And the story ends with them falling in love. There's a lot of like comedic humor, and just their relationship throughout the film is represented very cutely in like a rom-com drama way. But what is schwannoma neurofibrosarcoma? It is a malignant melanotonic Schwannian tumor, which is a rare peripheral nerve sheath tumor. So what that means is it grows in the nerves in between spines in like the lacerations. It is very rare. It's typically benign, and it typically starts out as benign, and you can watch it be benign, but eventually over time it will turn malignant, which is cancerous, throughout its long-term behavior. So regardless of this tumor, it will always turn cancerous. It typically has gradual symptoms that last over a month because it grows, and maybe even years. So it might even take a while to determine it. But sometimes they are really acutely present and occur over days or weeks. So in Adam's case, he had back pain for a couple of months, and it was a tumor growing in his spine. So typically they arise from the dorsal nerve roots, cranial nerves, sympathetic chain, lumbar plexus, and gastrointestinal tract. So in Adam's case, it was the lumbar plexus, which is a part of his spine. For this type of cancer, there is a 40% 5-year survival rate. The majority of the tumors start in the lungs, but they rarely show up in between the T8 and the T9 vertebrae, which was in Adam's case. Radiation therapy is typically less effective, which we also see represented in the film because there was no shrinkage of the tumor, even though he went through months of chemotherapy. Typically, they suggest a combination of neural decompression and stabilization of the spine to help have a benefit on the cancer. But it is a high case fatality rate with a frequent local reoccurrence, bone invasion, and remote recurrence. So what that means is a lot of the patients do pass away. And if they are able to survive, the cancer will most likely return locally where it was, invade the bone where it was, try to spread through the bone, or it could even occur remotely away from where it was. So if Adam had it in the spine, it might show up in his lungs next or in a different part of the body. There's no way to predict, but it is very aggressive type, so it is typically likely to keep occurring. From a social work perspective, this movie, some of the major themes are denial, anger, and alienation. Adam wants to protect his family in any way that he can from worry or fear, and that kind of enhances his sense of isolation. He actually waited to tell his mom a few days that he had cancer because he didn't want her to worry about it because his dad already has dementia. So he just didn't really want to add to their worry. And then going through a breakup would have been really hard to go through this time. Typically, it's actually pretty uncommon for people to go through a breakup during this. It's more common for the partner to become emotionally unavailable. So another thing that I kind of noted in this was the doctor insensitivity versus the therapist. They were kind of on two different ends of the spectrum. The doctor was listing off his diagnosis and never really paused to give him a moment to let it sink in, to understand. He just kept kind of rattling and going on. So it was really difficult for Adam to understand exactly what was happening. However, the therapist was the complete opposite. It was her first time with a patient, and kind of just crosses boundaries, to be honest. Some of the social work concerns that I see is that he doesn't have rides after chemotherapy, which I think could be dangerous, even if he is taking the bus. I think there should be some way that we could be able to provide that service for him, or a rideshare program. And then the doctor-patient boundaries with Catherine and him, it's not ethical to have a romantic relationship within that mental health sphere. That they did, and it was a rom-com, but legally and ethically, that would not be a relationship that you would want to enter. He does have a lot of support from his family and friends throughout the film. They are both there for him throughout the breakup and throughout chemotherapy. He actually finds a book called Facing Cancer Together in his friend Kyle's room when he brings him home drunk one night. And then his mother confides in him that she has been going to a mother with children who have cancer support group because it's been difficult for her as well. So what my advice would be is to try to help get them a little bit more professional support. I see that they're reaching out to the resources that they have, which is amazing. So how can I meet them halfway and be able to give them more support they need, specifically with his father's dementia needs? That in itself is something that can be very difficult for a family to go through. So to go through that along with having cancer is something that we want to be able to address for him. It's kind of like that intersectionality of trauma, to be honest. So some of the questions that we would want to ask him are like, what are the strengths of his family? Does he feel like he's having adequate support? Is there anything we need to know about his spirituality or faith? And what can healthcare staff do to support you? He doesn't seem like the type to really ask for help, but I bet if we mention getting rides and different things like that, it could be something, maybe even meals. I don't know how far some of these things go, but he didn't go to any really other support groups other than his chemotherapy. So kind of having some of that would be helpful too. So kind of like to give him those guidance instead of him having to ask for it. And then to ensure his family has support, something we'd want to ask them is, how is your child's illness impacting you? Because they are also going through this as well. They took time off to be at a surgery and to be with him through that. So one thing about this film I think is really interesting is that it is loosely inspired off of a true story. The writer here in By the Blue Arrow, Will Reisner, was encouraged by Seth Rogen to share his story. So him and Seth Rogen are really good friends. So they actually encouraged him to write it, and Seth Rogen's character is based off of himself. And here are my references. Thank you. Have a great day.